Hi, I'm Marc Arginteanu. I'm a neurosurgeon with a private practice in the metropolitan New York area, and I'm an associate clinical professor of neurosurgery at Mount Sinai in Manhattan. One type of neurosurgical procedure that I perform is with endoscopic, minimally invasive approach to brain surgery. This type of surgery may be useful for patients with hydrocephalus, water on the brain, or even for certain types of brain tumors. Although I describe the risks of surgery in clear language, it's not always easy to understand that while under anesthesia, mere millimeters become the difference between a good outcome and a terrible complication. This type of surgery, along with many others I perform, requires a no room for error mentality. Years of training and experience with thousands of patients have helped me minimize the rate of my complications in my patients. Prior to surgery, CT or MRI data is merged with a computer guidance system. Without this crucial first step, it would be like driving in a dangerous neighborhood of an unknown city with a faulty GPS. Next, I introduce a camera, the diameter of a pencil, through a dime-sized hole that I create in the skull. This requires extreme precision. If any part of the camera crosses through the wrong part of the brain, called eloquent cortex, it can leave the patient paralyzed or unable to speak. This is where my no room for error mentality really comes into play. Once I get to the target, the fluid space in the center of the brain, called the ventricles, I guide the camera between the lateral and third ventricle, and it's a tight spot. It's a little tunnel called the Foramen of Monroe. On one side of the tunnel is a big vein, the Thalamostriate. Any damage to that vein and the patient could have a devastating stroke and could be put into a vegetative state. On the other side of the tunnel is the Fornix. Any damage there and the patient could lose the ability to form new memories, similar to Dory from Finding Nemo. Sometimes I need to open up the floor of the third ventricle. Right below the floor is one of the major arteries of the brain, the basilar artery. A false step here could cause a terrible stroke or brain death. It's for all these reasons and more that it's impossible to be successful in neurosurgery without a no room for error mentality.